Hi, so my name is Kylie Rodriguez. I am the Benefits Specialist for the Greater Tompkins County Municipal Health Insurance Consortium, or most people call it the consortium. My role there is to provide information about benefits, deal with claim issues, and overall look at comparisons of plans. So if you have questions, or maybe you think of questions after the presentation, feel free to reach out to me. I will be providing my email and information when this goes out as well. So what was requested of us is to get together and compare the City of Ithaca Executive Association benefits, the Classic Blue plan versus the Platinum coverage. And throughout this presentation, we're going to talk about the differences when it comes to premium benefits, out-of-pocket costs. We did run some Excelis reports to show the different out-of-pocket expenses that have essentially been incurred, Classic Blue versus Platinum, and then discuss some of the additional benefits you obtain through the Platinum coverage. So this first slide, when it discusses premium, don't be intimidated. This is not your cost share. This is the total amount of the monthly premium for the plan. So for individual, it's $1,150 roughly. For Classic Blue, for Platinum, it's $728 versus the family coverage for Classic Blue is $2,492. And the Platinum is $1,895. So as you can see, there is a drastic difference in those monthly premium rates, but this is not the employee cost share. We were told by Steve Thayer, and you can correct me if I'm wrong on this, that the cost share is 20% for the employee and 80% that the city covers over the course of a 50 pay periods per year. So what that breaks down to for the percentage is for individual under the Classic Blue, it's $55.19, Platinum's $35 roughly, and then the family for Classic Blue is $119 versus the Platinum, which is around $91 for the family. So these rates are reflective of that 20%. They do not include an upcharge, which when we presented to the PBA unit for the city, their negotiated contract, and I'm not sure if this will happen with the executive association or not, reflected an upcharge, and the upcharge is the difference. They have to pay the difference in the premium amount, and it's not the difference in the 20%, it's the difference in the overall total. So it's quite a drastic increase to the Classic Blue coverage if they wanted to remain. I don't know if that's happening with your contract. I just wanted to give you a heads up about it. So overall, there is still savings between the two plans if you were to switch to Platinum when it comes to the premium. So the savings per pay period is listed here. Individual savings would be $20 per pay period. Family would be $28. And then we did the annual to look at the yearly savings, which is roughly, you would save $1,000 on individual coverage or $1,400 for family. So when talking about Classic Blue versus Platinum, both of them are PPO plans, which means they have in and out of network benefits, which is important to know in case you go outside the Blue Cross and Blue Shield network, you would still have benefits. The Classic Blue is more of a plan where you pay more upfront in the premium, but less when you use the coverage, versus a Platinum plan that you pay less upfront in the premium, but you pay copays when you use the coverage. And trust me, I'll be less broad in a minute when we dive into the benefit details. But it is something to consider of, would you rather spend more out of your paycheck on the coverage or less out of your paycheck on the coverage, and then copays as you use the plan. The Classic Blue does have out-of-pocket costs with it as well, which we will review in just a second. So before we dive into what's a copay and things like that, I just wanted to go over some general concepts when we talk insurance. So the first one is a deductible. So the deductible is the amount of money you have to pay out of your own pocket before the plan kicks in to start covering the service. The Classic Blue does have an in-network deductible associated with it, where the Platinum does not have an in-network deductible. The other term is an out-of-pocket maximum. So out-of-pocket maximum is not the same as a deductible. So once you meet your deductible, your coverage starts, you maybe pay your 20% or you pay your copay, what have you. An out-of-pocket maximum is what all of that money is going towards. So every co-insurance or every copay you pay when you have a service done goes towards your out-of-pocket maximum. Once you've met your out-of-pocket maximum for the year, you then have 100% coverage for the remainder of the year. Most people don't reach their out-of-pocket maximum unless they have high medical expenses, but the Classic Blue plan does have a lot lower out-of-pocket maximum than the Platinum. So then the annual maximum and lifetime maximum, we're not really going to discuss them because neither one of them apply to these two different plans. Classic Blue and Platinum do not have them. So there is no limit to how much the insurance will spend each year on you. There is no limit per lifetime that the insurance will spend on you. Those limitations just really don't apply to these plans. So when we look at cost sharing, so we just talked about what a deductible is. So Classic Blue has a $50 individual deductible or $150 deductible for family plan, whereas the Platinum does not. Now this is for in-network only. Platinum does have a separate out-of-network deductible if you were seeing out-of-network providers. Out-of-pocket maximum for Classic Blue is $400 for an individual and $1,200 for a family. This is only for medical claims. It has a separate prescription maximum out of pocket, which most don't meet because it's rather high. The Platinum combines your medical and your prescription out of pocket expenses for one out of pocket maximum. So for individual, it's $2,000 and for family, it's $6,000. Do we have any questions on this before I kind of move on? Okay. So when we compare benefits, the big thing that I tell people when they want to compare insurance is look at where you're using it, right? So we of course want to look at, well, how much is it going to cost me to go to my primary doctor? If I were to go to a specialist, what is it going to cost? Urgent care and ER are also common ones to look at for the just in case. What if I get sick on the weekend and I want to go to urgent care? How much is that going to be out of my own pocket? So here we have Classic Blue in the middle column and Platinum's on the far right. And as you can see, Classic Blue really is an excellent plan. It provides 100% coverage for most services. When it comes to routine, like doctor's visits, though, you are going to have to meet that deductible before the coverage kicks in, and Classic Blue pays 80% and then you pay a 20% coinsurance. Now, a 20% coinsurance doesn't sound like a lot. For a primary doctor's visit, it normally isn't that high, but when it comes to specialists, it can be higher depending on what they're doing in the office, if they're running tests and things like that. Platinum does not have a deductible. They have set copay amounts. So if you go to a specialist and the bill is $2,000, you're only going to pay that $25 copay. Everything else would be picked up by the insurance. With urgent care, it's a set $40 copay. Emergency room is a $150 copay. Whereas with Classic Blue, urgent care and the emergency room would be covered in full. The same goes with like advanced imaging, like MRIs. Classic Blue covers it in full. Platinum has a $25 copay. Other services you may want to look at if you had higher medical needs would be like chemotherapy, treatment, radiation therapy, dialysis. These are all covered in full services through Classic Blue. With Platinum, the chemotherapy and radiation do have a copay amount that goes with it. $15 for the chemotherapy, $25 for the radiation. I see a question. Yes.
It's not clear to me what these copays are referring to. So chemotherapy, $15 copay. This is per visit, right?
Yes.
Okay. And then similarly, I think on the other page, the previous slide, there was something about, it says preventative care covered in full for Classic Blue and Platinum. I believe that one or two visits to your general practitioner a year are considered preventative and are covered in full, correct?
If it's for a routine physical, that would be preventative. But if it's
Okay.
for, I have a cold and I need you to check me out, that's not.
Sure, right. So
Preventative,
physicals are covered in full under Classic Blue. There's not a 20% co-insurance for that necessarily, unless it's over and above your, twice annual, I think it's twice annual doctor checkups.
and then the platinum would cover the routine physical as well in full. It would be considered a preventative and not incur the copay. Right.
Okay.
Yep.
And then emergency room, $150 copay for platinum. Is that for your entire stay? Is that per day, or what is that for?
So emergency room is a fee that you would pay if you were only seen in the ER. Like, I fell, I broke my leg. Okay, we're casting it. We're sending you home. We're not keeping you overnight. That's that $150 copay. But if it was more, oh, you really needed to come to the ER, we're going to have to perform emergency surgery, you're staying for a few days, there is no copay for the ER at that point. It then rolls into an inpatient hospitalization, which is right below it.
Mhm.
And that would be a $250 copay per stay, not per day, per stay. And that's kind of how it would roll into itself.
Okay, thank you.
The other thing that's different between the Classic Blue and the Platinum plan is the Classic Blue does not cover routine eye exams. It does not cover routine hearing evaluations. It does not cover eyeglasses, and it does not cover hearing aids. So these benefits are also listed here. Where the Platinum plan does provide that coverage, it'd be a $25 copay for a routine eye exam, a $60 allowance for eyeglasses for adults. There is a different benefit for pediatric. And then routine hearing exam would be a $25 copay, and hearing aids, one pair would be covered at 50% coinsurance up to $3,500 every 3 years. So these are additional benefits that you would be gaining by moving to the Platinum plan. Yep, go ahead.
Could I please ask another question?
Yeah.
About the vision exam, routine vision exam, is that for eyeglasses only, or is that for eyeglasses and contact lenses both?
It's for eyeglasses or contact lenses, yes.
One or the other?
It's to determine your prescription. So that's what a routine exam is versus a diagnostic, which would be to see if you have a medical condition with your eyes. So yes, it would cover one or the other. But if you're doing both at the same time, it would only cover one of those exams, if that's what you're asking. Yep.
Okay, thanks.
In addition, there's wellness programs that come with the Classic Blue and the Platinum. So the Blue 365 discount programs, that's pretty much for any member of an Excellus insurance, and it offers discounts on different wellness things, like maybe a Fitbit, or you can get discounts on glasses, different things like that. They have an online website where you can look up discounts based on your ID number and creating an account and things like that. The Platinum plan also comes with access to the Blue for You wellness program. The city just added an incentive program this year to people who have it in their negotiated contract who are on Platinum coverage, that they can receive a certain dollar amount of incentives of going through this Blue for You wellness program. Now, Blue for You wellness program is done through an independent agency. None of the results are given to the city. They're not even really given to Excellus. They can be sent to your primary doctor, but it's a biometric screening that does blood work and then talks to you about different precautions, or are you at risk for diabetes, things like that, and has an education component to it as well. We did not include the information on the incentive program through the city because we weren't sure if they're offering it to your negotiation group, and it would be something that they would present to you when they meet with you. but we did want to make you aware that you would have access to these Blue for You clinics and be able to go and get a biometric screening done for free. And then any incentive beyond that would be offered through the city. So we've kind of touched on different medical coverage. Along with the benefits comes, of course, the prescription coverage or pharmacy benefit. And the copays here, you can tell, do take a drastic increase with the Platinum plan. Both of these plans go by the same formulary. They go by the same prior authorizations, the same quantity limits and step therapy requirements if the medication warrants it. So really the only difference between the coverage is the copays. So tier 1 stay the same for both the Classic Blue and the Platinum for retail and mail order. When we hit tier 2 or tier 3, you see about a $20 increase on the tier 2 retail, and then you see a $40 increase for the tier 3 retail. Mail order is a 90-day supply, so the jump is a little bit more drastic because you're getting a 90-day supply instead of a 30-day supply. But tier 2 with Classic Blue is 30. With Platinum, tier 2 would be 70 for mail order, and tier 3 is $60. It would jump to 140 with Platinum for a 90-day supply. And if you're wondering what tier your medications are, you can find out that way a couple ways. You can call ProAct and ask them to tell you what tier your medications are. You can create a ProAct portal account and look up your claims, and it will tell you what tier your medications are. Or if you're familiar with what your copays are, you could then kind of figure it out from this chart. I will say that if, let's say you're on a tier 3 medication, but the cost of the med is only $10, but here it's saying my tier 3 medication is going to be $70 if I'm on Platinum, you always pay the lesser amount. So if my tier 3 medication is $10, I'm only going to pay $10. It's up to that $70. So if it's below that $70 copay set by Platinum, you pay the lesser amount. Okay. So here we have claims information. So we were able to pull some of the Classic Blue claim information, but when it came to Platinum, we didn't really have enough data. So we pulled it from the overall city group who's on Platinum, because there's not, there's more people to pull the data from. So this kind of just shows you the average out of pocket for in and out of network. The big reason why these are the same with Classic Blue is because their maximum out of pocket for in-network is the same for out-of-network. So if you meet your in-network maximum out of pocket, you've also met your out-of-network. So the most you're going to pay out of pocket for an individual would be that, the deductible plus the maximum out of pocket. And then after that, everything's covered at 100%. This is the individual Platinum. And as you can see, it's a lot less, because they're still providing good coverage, and then you're only paying those copays. There's no deductible to meet, like the $50, the $150 deductible to meet, to start seeing that coverage in action for routine visits and things like that. So for Family Classic, you know, it does show a little bit right around the same amount as the individual, a little bit less. And then the Platinum obviously shows a little bit more, but it is family, so it's covering more lives on that plan. And then the previous slide was 2021, this is 2020. Some of these adjustments can be due to enrollment as well, since the city really has seen a bigger increase in Platinum enrollment in 2021 than they did in 2020. But to just give you an idea of what these out-of-pocket expenses look like. So to conclude, both plans are great, right? And it's about usage. It's about how you're using it. And it's a little bit about cost analysis, because if the premium for the Classic Blue, you know, stays at our numbers where we're at and doesn't have that additional fee then they're pretty comparable. It's not a drastic expense to stay on the Classic Blue. But if the premiums are not where they're at and they have that additional fee, is it cost effective to stay with the Classic Blue versus the Platinum? The other difference is if you're paying for Classic Blue and you're only going to maybe your doctor once a year, you're not on any medications, are you overpaying for insurance? Are you overinsured for what your needs are? These are questions that you would ask of yourself and analyze, where you're comfortable. The other aspect is looking at, am I okay with being overinsured as long as I have the peace of mind of knowing if I go to the hospital, it's 100% covered versus the Platinum plan that's $250. We do have members as well who establish FSAs, their flex spending accounts that can then be used to pay the copays for Platinum. Any copays that you incur when you go to the doctor, the specialist, things like that are a viable expense to use your FSA for, which is just another avenue to look at. So this is just general overall conclusions of what we've just discussed about how Platinum offers additional benefits. The Classic Blue does not when it comes to vision and hearing, as well as the Blue for You Wellness program. And then discussing that Classic Blue has a deductible where Platinum does not for in-network benefits. But at this point, I would ask, are there any questions about the benefits we went over?
I guess I have one more question. Often when I've been to the doctor, say I need to go and have an ultrasound and then I need to have some other blood work done or whatever, and everything's with different doctors and they have different, if you have some complex procedures done, you don't usually have just one doctor look at you. You have different doctors and they're doing different procedures, and each of those things is billed separately. So if we were to go back to one of the screens that compares the Platinum and the Classic Blue, like this, for instance, the copays for Platinum, say you have an office visit and then another doctor comes and does x-rays for you, and then somebody else comes and does whatever, and each of these people are charging you separately. That visit actually with the Platinum plan would be a copay for this and a copay for that, and a copay for this doctor, and it could add up. It's not like you go to the doctor for one thing and you get a $25 copay and that's it, right? Like every procedure that you have done at your visit is billed individually, and then it has a copay individually. So I just wanted to, am I wrong about that? Or I think that's typical. I get.
You're not wrong. You're not wrong. It does depend on the billing code, and it depends on how it's billed. Some specialists divide things up by what they're doing, and some just lump it all into an office visit. And if it's lumped into the office visit, it's a one-time copay. But for your example, let's say you go to the doctor and they say, well, I want you to have an MRI before you come to see me. So you're going to get an MRI done. That's $25. You saw that specialist. And then 2 days later, you're going to go see the specialist who's going to tell you about the MRI. That's another $25 because you're going to go see that specialist who's going to tell you about your MRI. So you're not wrong in that instance. No.
Okay.
I do understand what you're pointing out. Yes. And I mean, if I've worked with a lot of members who are higher medical need, who see more frequent doctors than others, it can add up on you. That's, planning ahead is also part of the idea, right? To plan, well, if I know I'm going to see my specialist at least 4 times this year, maybe I put that money into an FSA, reduce down my tax liability on my paycheck, and have the money ready to go if I need it.
It's very hard for an individual to know what a health system is going to charge them for. This whole thing to be like a good consumer of health care and plan ahead. Like you can't do that when you don't know what they're going to bill you for, or the fact that they bill you separately for somebody to read your x-rays versus the people who are taking the x-rays. And for each of those people who looks at something, it's another copay.
Right.
So, okay. Just,
and I mean, I often equate, you know, when you're shopping around for health insurance, it's like shopping around for car insurance. Do I pay for the extra glass coverage, or do I say, yeah, I want the $200 deductible on glass coverage for the just in case I get a crack in the windshield? You know, it's all about what you're comfortable with when it comes to insurance and seeing, you know, where that cost is. Some of the city employees who moved to Platinum took their premium savings that they had and put it into an FSA because they were concerned about how much their out-of-pocket may add up to. It's just an idea. It's not saying you have to move. I think the Classic Blue is excellent coverage.
FSA, unfortunately, then if you don't use it, you lose it. And I don't know who agreed to that, but that's not fair for employees at all. So
that was just an option they took. It wasn't mandated or anything.
No, I understand that. I'm just saying, like, yeah, I appreciate the clarifications.
Yeah. Are there any other questions when it comes to the benefits or the premiums? I can go back to those as well.
What is the difference about out of network? Is that about the same? Do you pay about the same for out of network providers with both plans?
Sure. One second. Let me switch what I have up here real quick. I had a feeling I was going to get asked that because that's actually a common question with your group. And I think it's a great question.
You know, I think there's like certain providers like chiropractors and stuff like that that often just don't want to deal with insurance, and so they're not in any network. And if you found one that you like, you know, just thinking like, well, what's it going to cost me to stick with that person versus like, well, if it's an in-network person, I'm only paying $15 copay.
Let me just see if I can get it up here. I'm not sure how well this is going to be viewed, but we'll do our best here. Bear with me. So, and obviously I will send this out after the fact so you can all review it. But this is an overall comparison of the two plans, and it really gets into the nitty gritty of in and out of network and expenses and things like that. And I'm hoping everyone can see this. I hope I made it big enough. So with the smaller, so the Platinum is the center column and Classic Blue is over here on the right. So when you look at out of network benefits, a majority of the benefits for Classic Blue are the same whether you're in or out of network, but you are subject to balance billing when you go out of network. Whereas with the Platinum, you go from a set copay amount to a percentage. You go to a 20% coinsurance that you would owe, and it has an out of network deductible as well. So $500 for individual and $1,500 for family. So let's say you were going to a chiropractor you really like, you would have to meet, and let's say you're on individual plan, you would have to meet this $500 deductible. And then once that's met, it would be paid for at 80% and you would pay 20%, but it is also subject to balance billing because you're going out of network.
What is balance billing?
So balance billing is you have, let's say the bill is $200 for whatever you're having done, and Blue Cross and Blue Shield says our allowable rate's $100. So then that $100 is what can be billed to the insurance. But when you go out of network, you don't have that Excel stepping in and saying, no, this is what we're going to pay on. So that difference between the 200 and the 100 is something that you could be owed.
So in that
That's the
example,
balance.
you have a $200 bill. The insurance is only allowing $100 to be billed back to them. And then of that, they're only going to pay 80% of that. Okay.
So you'd get billed the 20% of the $100, but then you could also be billed the $100 difference between the 200 retail and the 100 allowable.
Right.
Mm-hmm.
So like in that example, like it might not be $100, you know, might not cover only 50% of it, but to use round numbers, that would be that example.
Right.
Okay.
Right. I will say, I mean, I know in our area, Excellus struggles to have in-network mental health providers. They struggle to have in-network chiropractic providers. It is a topic we have brought up from the consortium to Excellus to look into and to market as best they can in our area, because we have had members bring those topics to our attention. And the search is difficult, especially with COVID increasing mental health therapy needs. Finding an in-network provider is difficult, and we do assist our members with that if that's something they're struggling with, but we are aware of that kind of issue. But it's not just an Excellus issue, it's all insurance. We've been finding that a lot of providers don't necessarily want to take any insurance because it's just not cost effective, right? I don't want to take your allowable rate when I can just take the full amount and be paid the service, the amount that I'm billing. So was there more on this chart that you might want me to review, or I will definitely send it out, but I just wanted to show you that comparison of in and out of network benefits.
This chart has the columns reversed, right? Where we're looking at here is the left column is the platinum and the right is the classic blue. Yeah, okay.
Yep.
So yeah, it seems like the big differences here is if you go out of network with platinum, you first have to meet a $500 deductible as opposed to the $50 deductible for classic blue. And then your out-of-pocket maximum for a family, which is my situation, is $9,000 out of network versus $1,200 with classic blue.
So the interesting part about family is for the out-of-pocket maximum, if one person in the family meets the $3,000 individual out-of-pocket, then they've met their out-of-pocket for the year. But if you're looking at the overall family, then you'd have to reach the 9,000. But I have had families where there's someone who has a high medical need, they meet the 3,000 individual or the 2,000 individual if you're in network, and then they have 100% coverage for the rest of the year for that individual on the family plan.
That's interesting. Okay.
Were there any other questions about the in and out of network benefits?
I think I did send this out. You had sent this to me previously, Kylie, and I had sent that out. So, but I think it's good to send it again. And one of the questions I had for you was the difference between, what was the question I had? It was like covered at 80% after deductible, and there's another, it worded it differently in another column.
Oh, yes. I think it was 80% coverage subject to deductible. And you said, is that any different than covered at 80% after deductible?
Right.
No, it's just the wording.
Okay.
So yes, either one means the deductible applies first. Once that's met, then you have 80% coverage and you pay your 20% co-insurance.
And then the balance billing that you were talking about, like it says that in some of the columns, but that for any out of network that says covered at 80%, that all of those would be subject to balance billing, not just the ones that specify it.
Yeah.
Okay.
It kind of honestly got a lot to put in the
Yeah,
spacing.
sure.
So, but yes, any out of network benefits are subject to the balance billed charges as well.
For the classic blue, it says in network. I'm looking at what's currently at the bottom of the page.
Okay.
Specialist office visits say covered at 80% after deductible or primary care. Does this have balance billing as well for in-network or not?
No.
Okay.
Nope. Because when you go in network, you're seeing a provider that signed a contract with Excellus to accept their allowable rates. They then can't bill you the difference.
I see. Great.
Were there any other questions on this chart?
I don't have any more questions. I don't know if the others, Brooks or Adisu or Alfonso, if anyone has any other questions, speak now, or I'm gonna let Kylie go to her next thing that she's got to do today. But thank you very much, and you're recording this, and you will let me know how the people can access that. Correct?
Yes,
And then
yes,
can
I
send it
will
out.
email out the presentation as well as the chart that I just showed you, and then I will let you know how to access the, typically we record it and post it on YouTube, so I will let you know how to access that video as well for review.
Okay. And I saw
All
Brooks,
right.
you went off mute. Do you have a question or no?
I don't have a question. I was just going to tell you I don't have any questions.
Oh, excellent. Thank you, Mr. Bruce. Okay,
Thank you.
so I guess that's all we've got. Thank you so much, Kylie, for taking the time to do this for us. And I will follow up with everyone with more information.
Sounds great. Thank you so
Okay,
much.
Thank you for
Have a great
answering all the
day.
questions.